Welcome back, everyone, to Good Morning Wilmington. Our last guest here on the plaza is Dr. Aaron Weaver, the owner of First State Direct Primary Care. Welcome, Dr. Weaver.
Thank you for having me. Pleasure to be here.
Yes, we're excited to have you. So before we jump into First State Direct Primary Care, tell us a little bit about yourself.
Yeah, so I'm a primary care doctor, and I'm originally from central Pennsylvania and moved down to Delaware. My wife is originally from Delaware, so that's what brought me here.
It'll do it to you every time.
Exactly, yeah, like any good Delaware relationship.
Yeah.
I was brought down here. So yeah, it's been fantastic. I've lived here for about 12 years now.
Nice.
And so I did my medical school training at Philadelphia College of Osteopathic Medicine, and then I did my residency in family medicine at St. Francis Hospital here in Wilmington.
Okay. Nice, nice.
So you know the state fairly well by
Yeah,
now.
yeah, I'm pretty familiar.
Excellent. Well, so what made you want to get into medicine?
I really think just honestly helping people. I know it sounds a little cliche,
No, it doesn't.
It's important.
but for me, it was really my father was a big motivation for me. He is a Methodist pastor actually, and so we moved around a lot as kids throughout Central PA, and I just saw him every time we moved. He just engrossed himself in whatever community we were in and became a part of that community. And I saw the way that he touched people's lives and just genuinely helped people. And I also had an interest in science and in medicine, and I thought, primary care is kind of the best of both worlds there, in that you are able to take care of people and also provide them with a really valuable and needed service.
So, okay, I love how you did that. All right, I love that story. So how does that encompass and interweave
Right.
with direct primary care, with what you created,
Yeah.
like what you've seen and witnessed from your father
Yeah.
and the community to now medicine?
Yeah, so I think just to go back a little bit, in my career, I was an employed physician prior to starting this company. And so I worked in traditional healthcare, so to speak. And what I realized is that there are a lot of barriers to care, and there are a lot of people that get in the way between the patient and the doctor, and all these third parties. And really what I mean is, insurance companies and health systems and other third parties that kind of put themselves between you and your patient. And it's frustrating on both sides.
Right.
And so what I really was in search for was a different way to deliver care, where we really kind of restored the doctor-patient relationship. And by contracting with the patients directly, we work for them. I work for you now. I get paid by you. I don't get paid by an insurance company. And what I'm able to do is that it just pulls off all the restrictions, and I'm able to have longer visits that actually run on time. I'm able to go to people's homes without worrying about, am I going to be reimbursed? Is it going to be covered by their insurance? Because I get paid directly by the patient. And it's great.
Hold on, Doc.
Yes, yeah.
You mean to tell me you leave corporate, just to say, we call it corporate, you leave corporate because you see the system is broken and go and create another system?
Yeah. I mean, this has been
It's been done before.
across the country.
Okay.
There's a couple practices in Delaware, and so, but really, I want to make this something that changes the way that Delaware does primary care and has their primary care delivered. And one of my visions, and I was just talking with the councilwoman during the break, is to, I'm in Newark right now, but is to have this in different communities that need accessible and affordable health care. And so that means Wilmington, that means Newcastle, that means Claymont, et cetera.
All right, give some of the viewers at home just an example, like we talked prior to.
Yeah, so I'll give you an example. So our grand opening is September 5th, but we're kind of a soft opening now during the month of August, where we're seeing a few patients. And I'll give you a perfect example. A patient called me. I was actually getting, I can't make this story up. I was getting honey grow. I was driving. They sent me a text first, a secure text through our electronic medical record, and sent me a secure text which popped up on my phone and said, "Hey, knee is really hurting. I think I'm going to go to the ER." I called them. immediately. This is 7:30 at night on a Saturday night. I called them and talked to them for 5 minutes, got the history, said, hey, I think you're having an arthritis flare-up of the knee. No need to go to the ER.
Right.
Let's get you some prednisone, right? Just based on her history, that's what worked for her, so we get the prednisone. She took that, and for a couple of days, and pain subsided greatly, avoided an ER trip, which the average ER trip in Delaware costs $1,500. Okay, cost of that prednisone, 40 cents. Okay, the cost of 40 cents total for the amount of prednisone that she took. 8 cents per pill. She took 5 tablets.
Wow.
So, yep.
So you're able to, this is obviously a very different experience that you're offering.
Yep.
That it's not, you have to go through all these other avenues to get to the doctor, to get to the care. It's very, how would you say, almost like a VIP kind of a service, like a direct call to the physician and an immediate care right away. Now, you are still accepting, but are you still accepting patients?
Yeah,
Absolutely.
absolutely.
Okay, you are.
Yep.
Okay.
So we're enrolling patients right now. They
All
can,
ages?
All ages.
Okay.
We see newborn through everybody, basically. We take care of everybody there.
He's going to stop accepting after this.
Yeah.
You're going to be at my list. Remember us?
And so, but I want to touch on that actually about the VIP level service. So, and because some people were kind of confusing it with this concierge medicine.
Right, I've heard of that.
And thinking that it was just unattainable for so many, and it's only for the elite in our community. But it's really not. What we've done is created a clinic where everybody can afford a monthly payment. For adults, it's $55 to $75 per month based on your age.
Wow.
So for less than a phone bill, you can have access to primary care, and that's without visit fees. That's without copays. In-office procedures that we do, like an EKG, to check your heart, spirometry to check your breathing, et cetera. That's included in the fee.
Wow, that's really an amazing service to have, to offer.
I'm sitting here speechless. I'm like, wow.
It's very, but I think it's, you're right. People get confused with the concierge services that it's not attainable, or they don't have the funds to have that type of care. So this is very affordable, especially someone that may need a physician a lot, because they have health ailments and they need to call their primary care doctor for whatever reasons, but it's good to have that as so easily accessible. And I think that's what's important, because you're right. All right, I'm going to the ER because I don't know what I have. I can't get in touch with my doctor. They won't call me back, because that has been something that has been an ongoing problem. And we understand the pandemic has really put a dent into the healthcare world. It really has. And it's caused a lot of practices to fall behind, and they can't call you back.
Right.
They already couldn't call you back before. Now they're not really calling you back, and that's a problem.
Right.
So you go to the ER, and then, like you said, $1,500 later. So that's really incredible that you're offering this. So you're still accepting patients.
Yes.
How can they find out information about your new business?
Yeah, so they can call our office phone number, which is 302-722-7082, or they can go online, firststatedpc.com. And they can find out all the information they need. They can get in touch with us there. And you can even enroll online. To be honest, no more sitting in the waiting room filling out that paperwork. Our enrollment and health history and everything is embedded in our website securely, and it goes right to our electronic medical records.
Right. And your website is pretty much straightforward. Why is transparency? Why is it so much? Why does it mean so much to you?
Well, because I think that, I've experienced the healthcare system even not just as a doctor, but as a patient. And to be honest, this goes back to before I was even in medical school, where I didn't know, I had to get an MRI, and I didn't know what the price was. I thought I was going to have to sell my Hyundai Elantra to pay for the MRI. But we experience it every day. I hear stories now every day about how I got routine blood work done. And I was just praying 3 months later that the bill would be acceptable and low enough. And I'll give you another story. Yesterday, I got a message from a patient of mine who just said, hey, I just have terrible insurance coverage. Even though I have insurance, I have really high deductible, and my basic labs were $416. That's just for your blood counts and your blood sugar and your cholesterol. And I said, hey, I actually looked at the bill and I said, let me give you the price that we can get for you. Straightforward, before any blood is drawn, $22 for the same blood.
Wow.
So that is in a person that is mid-30s. And so if you get that blood work done once, twice a year, that more than pays, the savings there more than pays for the membership to the practice.
Right.
And in addition, you get high quality primary care.
What do you think, Dr. Weaver, that this model can do for marginalized communities?
Yeah. Well, I think that it can give them, access that they've never had before, for a price that I think anybody can afford, any household can afford. And in addition, decreases the utilization of the emergency room, of the hospital, of the urgent care, where there is so much disjointed care that goes on. And in fact, or in turn, I should say, can make the community healthier.
Right.
Yes.
Yeah. This is true value-based care. All right. This really is, because we are not concerned about just having this patient mill where we have to see 20, 30 plus patients a day. I've done that before and spent 7 minutes on average with the patient. This is where we use all of our innovation, whether you have to come into the office, whether we can see you on a video, whether we can just handle something via you sending us a photo.
Right.
We want to give you the most value.
Wow.
Wow, that's amazing what you're doing and offering this resource in our community, and you definitely need to expand into Wilmington.
Yeah.
And Claymont all the way, actually Newcastle County.
Yeah. Might as well just
or the whole state, might as well. We're manifesting this for you because there is definitely a need. There's definitely a need to have that care so easily accessible to you, and for $55 a month. I think that's very much attainable versus the visit to the ER, the $1,500 bill to the ER. So. And
so you mentioned small businesses too, and that is something that we already work with several small businesses that have signed up their employees. We're absolutely open to working with employers because a lot either they can't afford to offer their employees medical coverage because the premiums are so high. And so it's a good alternative that can work with a major medical. It can be paired with a major medical coverage by the patient to save it for the big stuff. The way that insurance was intended to be used, the way in America how we use every other form of insurance. Is to save it for the big stuff, for the catastrophes, to avoid financial calamity. That's it.
You have to come back, Doc. We have to. We're gonna have a health segment with Doc just rocking and rolling.
Just like the doctors, right?
Exactly.
Anytime.
All right. This is your community camera right here. Go ahead and let them know what you want them to know about First State Direct Primary Care.
Oh my gosh. Well, number one, just thanks for listening to me this morning. But I am so excited about this clinic and what we can offer you in the community. And so if there's anything that you need or you feel that I can offer you in terms of primary care, please reach out to me, give me a call. This is not a posh concierge medical practice. This is a practice that I started out of the trunk of my car and a UPS mailbox. And so I'm here to work for you, the people, and to give you the best value for your dollar.
Awesome.
Excellent.
Dr. Weaver, thank you so much for coming.
Thank you, guys.
Really
appreciate
appreciate
it.
What's up, everyone? It's your main man, Big Ob, the talk of the town, Mr. DETVCH.com, and I'm here with my wonderful and amazing co-host,
Vincenza.
We just stopped by to tell you to be sure, if you want any information on what's going on in Wilmington and to meet some dynamic people doing some amazing and great things, be sure to watch us live on Good Morning Wilmington on Mondays and Wednesdays at 10 p.m.
Oh, Ivan, 10 a.m.
Which he said, 10 a.m.
Listen to me, that's why he has me here. But yes, tune in live, 10 a.m. Monday and Wednesday on Good Morning Wilmington.
DETVCH.com.